Viewers, this is Koyeb Ranch. In this video, I'm going to share information about how to manage a cow that has just given birth to a calf or postpartum care protocol. A cow that has just given birth is also called fresh cow. The proper management of a fresh cow right after she gives birth or the postpartum or fresh period is critical to ensure that she recovers quickly, avoids metabolic diseases, and transitions successfully into her next lactation cycle. This critical period covers the first 21 days after giving birth or calving. The protocol may be divided into four main phases. The immediate postpartum care. Here, a care that is given immediately the cow has given birth to. And then the postpartum nutrition, the nutrition that is needed to be given immediately the calf given birth. And then health and disease monitoring. After the cow has given birth, you need to monitor it, whether it is still healthy or whether it may contract certain diseases. Fourthly, the housing and environment. Let us consider the protocols that is provided immediately after the postpartum care. In the first 1 to 2 hours, provide the cow with warm hydration. Immediately offer the cow a large bucket of warm water, between 20 to 30 liters. You mix it with electrolytes, molasses, or wheat bran. This replenish the lost fluids, stimulate the cow's energy, and physically fills the rumen to prevent any uterine displacement. At this stage, you also need to encourage bonding. Allow the cow to smell and lick her calf. The licking action or this licking action stimulate the cow's breathing and air circulation, while the cow also releases oxytocins, which helps her to contract her uterine and release down cholesterol vital for the baby. Consider sanitizing the udder. Wash the cow's udder or breast and then the thin quarters with lukewarm water and mild antiseptic to remove birth fluids and prevent bacteria from spreading to the nursing calf. Navel dip. Disinfect the umbilical cord immediately using about 7% tincture of iodine solution to prevent joint ills and umbilical infections. You also need to provide it with cholesterol feeding. Ensure the calf consumes 3 to 4 liters of high quality cholesterol within the first 1 to 2 hours of life to build her vital passive immunity. Cholesterol is the first milk that the mother gives to the calf. This first milk contains vital antibodies immunities. Consider the postpartum nutrition or nutritional adjustment. Immediately after the cow gives birth, the nutrition that you need to give the cow. Here you provide high quality forage. You need to offer her or the cow a free choice of highly palatable green hay or soft forage. Feed laxative energy rations also. You need to offer a light, easily digestible mash containing wheat bran, molasses, and crushed grains, any grains that has been crushed, for the first 2 to 3 days to keep her digestive tract moving smoothly. Boosts the cattle with minerals. A high producing cow loses massive amount of calcium through milk. Here you need to supplement the diet with calcium, phosphorus, and specific mineral mixtures to prevent dynamic drops in energy. Then the third point, that's health and disease monitoring. You need to monitor the placenta or track the afterbirth. The placenta or afterbirth should naturally shed within the first 4 to 12 hours. Do not pull it. Never forcefully pull a hang placenta, as this can tear the uterus or cause severe infections. Dispose of it. Once expelled, remove the placenta immediately from the pen so the cow does not eat it, which can cause digestive choking or blockages. Call the veterinarian. If the placenta remains trapped inside the cow for longer than 12 to 24 hours, contact a veterinarian immediately to treat it as a retained placenta. Watch closely for common postpartum metabolic disorders during the first few weeks. Conditions such as milk fever or hypocalcemia. This is caused by low blood calcium. The symptoms include weaknesses, uneasy walking, cold ears, or cow that is completely unable to stand. If this condition occurs, you need to provide calcium supplements like oral calcium bolus. Give it as a gel or bolus intravenously. Another condition that may occur after birth is ketosis. This may occur when energy demand exceeds feed intake, causing a cow to burn her own body fat rapidly. Look for a sudden drop in appetite, weight loss, or a sweet acetone smell on her breath. The standard medication for this condition include providing oral glucose like propylene glycol, intravenous dextrose for immediate energy and supportive treatment, such as B complex vitamins and corticosteroids. Mastitis. Inspect the odor or the breast or the teeth daily for heat, hardness, redness, or swelling. Ensure the calf is nursing from all 4 quarters or strip the teeth manually to relieve from pressure. This condition may require a combination of mammary antibiotics infused directly into the teeth or uterus, systematic antibiotic injections, and anti-inflammatory drugs for pain and swellings. Housing and environment. Consider providing clean bedding. Keep the cow in a dry, draft-free shelter with thick, fresh bedding like straw to minimize the risk of uterine or udal infections. You need to isolate if necessary. Keep the cow and calf in a smaller paddock or individual pen away from the main herd for the first few days to protect them from bullying and minimize disease exposure. Post-calving management protocols ensure a quick recovery for the mother cow and survival for the newborn calf. Knowing the immediate steps to take as a cattle farmer or producer would go a long way to help sustain your productivity. This is the conclusion of my video. Thanks for viewing. If you like this video, please follow, subscribe, and share. Stay tuned to more updates. Bye-bye.